So you start by washing your hands and pulling the curtain. Then you assess the situation. So the client's alert and oriented. There's no obvious distress. So there's no need to take any additional precautions. Hi, my name's Kayla Gilder. I'm a student nurse at Georgian College, and I understand you're here today because you're having a headache?
Yes.
So what is your name?
My name's Jaden Gilder.
What's your date of birth?
November 29th.
Okay, yes, that matches my records. So you're here today because you're having a headache, right?
Yeah.
Okay. So I'm going to start by asking you a couple questions. Then I'm going to perform a neurological assessment on you, and then after that we're going to discuss the findings, and it should all take about 15 minutes. So anything you share with me will only be shared with the healthcare team. If at any point you feel uncomfortable during the assessment, you can say stop, and I'll stop the assessment. Do you have any questions?
No.
Okay. And do you give me consent to proceed?
Yes.
Okay. Here, then you do. Okay, so then, are you currently taking any medications?
No.
Are you using recreational drugs?
No.
Okay, and do you have any allergies?
No.
Okay. So when did your headache first start?
A couple weeks ago.
And does anything make it worse or better?
The light makes it worse, and when I'm like standing up and stuff.
That makes it worse? Okay.
Yeah.
And can you describe the pain for me? Like, is it
It's like throbbing.
a throbbing pain?
Yeah.
Okay. And where in your head is the headache?
Like behind my eyes.
Okay, so then on a scale from 0 to 10, 0 being the no pain and 10 being the most pain imaginable, what would you rate it?
Probably like a 7.
A 7? And is this pain constant, or does it come and go?
It comes and goes.
Comes and goes. Okay, and what do you think this means?
I think it means that my head's going through some suffering.
You think so? Okay.
Yeah.
So then 5 questions. Do you have a headache?
Yes.
Yes. And do you have difficulty swallowing?
No.
Do you have any difficulty talking?
No.
Do you have any past or present head injuries?
No.
And do you have any numbness or tingling?
No.
Okay, so then I would take her vitals. SpO2 of like 98, respiratory 18, blood pressure 115 over 75, her temp 36.5, and a pulse of like 78. So then you inspect, so her motor movement was all good. Her gait is strong and full of coordination. There are no tremors, and her weakness, there's no obvious weakness. So then I'm just going to ask you to lay down so I can test your pupil reaction. So the first one is the PERRL, which means the pupils are equal, round, and reactant to light. So you just look at the pupils, make sure that they respond to the light by constricting, which they did, so that's a good test. So for the next one, the eyes opening. So just close your eyes, please. Okay. So if they open spontaneously, that is the full score that she can get. If they open to, like, the score would get lower if they're opening to speech or pain, and if there's no response. Her motor movement, so just open, and then open your hands, and close your hands. Okay, so she also obeys verbal command. The scale would get lower if she was reacting to pain, flexion with withdrawal, flexion abnormally, or extension abnormally. And then verbally, could you say the person, place, or time?
Jaden, Beaverton, and 10 o'clock.
Okay, so she's alerted to person, place, or time. The lower scales would be like inappropriate speech, you can't really understand, or when she talks she's kind of confused. So a fully alerted patient would have a scale 15, or score 15, so that's her score. So then I'm going to palpate from head to toe to make sure that your muscles are symmetrical. Okay. Okay. symmetrical. And then just put your feet up, please. Just pretend you're in a hospital bed because this is what we're working with. Okay. So her muscles were symmetrical. So then I'm going to test your grip. So I'm going to get you to squeeze this hand. So that's testing her left motor cortex. And then this one's testing her right because it's the opposite side of the body. Moves the opposite side of the thing. You can let go now. So then I'm going to test your leg strength so I'm going to put your feet up. I'm going to resist on one thigh and you are going to push it up, okay? Okay. Okay, so that's also by the opposite side of the body of the motor cortex. So then I'm just going to get you to sit up. And I'm going to get you to do some rapid movement by tapping your knees on the top and then the back of your hand. So just do that a little bit. Okay, and then speed up. Okay, so that is testing the cerebellum, and she was able to do it. Then the second one is the finger to finger. So touch mine a couple times. I'm going to start moving it. That's testing her cerebellum, and she also passed that. Okay, so I'm just going to have you stand up, and we're going to test your balance. So first I'm going to get you to do the tandem walk, which is where you step with one foot right in front of the other. Okay, and which tests the cerebellum. The second one is the Romberg test, so I'm going to get you to put your feet together, hands at your side, and then close your eyes. So you would assess her standing like this for 20 seconds about, and if she can properly stand, then that would be a pass in the test, so you're good. And then the second one, or the third one I'm going to get you to do is called the shallow knee, so you just put one knee up to test your balance. Okay, and then alternate. And that also is testing the shallow knee. Cerebellum. So then sit down, and I'm going to now be testing your cranial nerves. So I'm going to start with the cardinal test, and so I'm going to get you to follow my finger. Just don't move your face, only move your eyes, okay? Okay, and then the next one is the trigeminal nerve, something like that. So I'm going to start by first assessing the motor function, and by doing that I'm going to press gently on your jaw, okay? So I'm going to get you to clench the jaw. So both muscles are flexing, both and equal size. Open, close, and I'm going to try and open your jaw with my hand, keep it closed. So the normal jaw should not open like if you are trying. So then assessing the sensory. So I'm going to take this little cotton fluff, and I'm going to be touching three parts on your face, and if you feel it, say now, okay? Oh, and keep your eyes closed. Now. Okay, so she passed that one. And then the next one is the corneal. So I'm going to put this on the corner of your eye. Okay, so there's bilateral blink, which is testing cranial nerves 5 and 7. So then you do the spinal test, and that tests cranial nerve 11. So by doing this, I'm going to put my hand on your face, and you're going to push towards that side, okay? Okay, and then this one. Okay, and then I'm going to push on your shoulders, and you resist, okay? Push up against the resistance. Okay, so she did have movement in all that. So then you're good to go. I just have to do the S-bar now. So the situation. Jaden Gilder is a 17-year-old female who presented with a headache. Background, there's no history of head injuries. She does not have difficulty swallowing or talking, and she also does not have any numbness or tingling. So that's everything I found. So all motor assessments are strong and coordinated, like her gait and stuff like that. There's no tremors or weakness present in any of her muscles. Her eyes opened spontaneously. She responded to verbal command. She was verbally oriented, like she was oriented ×3. Her muscles are all symmetrical upon the palpation. Her eyes followed the movement. Her pupils are equal, round, and reacting to light. Her cerebellum test, she was able to stand, balance, or she was able to balance. She was able to walk with one foot in front of the other in the Trendelenburg, and she was able to balance in the shallow knee, that's what it's called, and R. So yeah, that's recommendation. I would just recommend that she goes for further assessment. Thanks.